syndrome.
Thank you, Alessandra. Thank you, Calogero. And first of all, I want to thank Giovanni and Claudio for this kind invitation and for selecting this abstract for oral presentation on behalf of all the investigators involved in this trial. It's a trial in progress abstract, so I just want to share with you this opportunity we can offer to our patients also in Italy, in many Italian sites. Patients affected by indolent systemic mastocytosis and monoclonal mast cell activation syndrome, thanks to the introduction and clinical development of this new compound, BLU-263. These are my disclosures. So we all know that systemic mastocytosis is a neoplasm driven by the KIT D816V mutation in about 95% of cases. This molecular alteration leads to increased accumulation of aberrant mast cells, not only in the bone marrow, but also in extramedullary organs, such as, for example, skin and gastrointestinal tract, thus leading to chronic, debilitating, and potentially life-threatening symptoms due to the release of mast cell-derived mediators. Most patients with systemic mastocytosis have non-advanced forms, in particular indolent systemic mastocytosis, which is commonly associated with skin lesions. And we know from clinical practice, but also from data coming from literature, that about 5% of patients with indolent systemic mastocytosis may progress to advanced forms over time, and these are characterized by very, very poor survival. But in our clinical practice, it's not uncommon to face also with other patients affected by a very rare entity, so-called monoclonal mast cell activation syndrome. For these patients, we don't have today a very active treatment available, and this kind of new drug, BLU-263, may be dedicated also to this kind of population. Despite conventional therapy, there remains, as I said before, an unmet need, not only in monoclonal activation syndrome, mast cell syndrome, but also in indolent systemic mastocytosis, because we don't have drug available for this kind of population. BLU-263 is a novel next-generation TKI, which derives from avapritinib. You already heard about this drug before by Alessandra's talk. Which is characterized by a minimal central nervous system penetration. And a phase 1 study has been conducted so far in healthy participants, showing that the once daily dosing is the best dose we can give to these patients. So this is a randomized, double-blind, placebo-controlled study designed to determine the recommended dose of this compound and to evaluate its safety, tolerability, and efficacy in patients with indolent systemic mastocytosis or monoclonal mast cell activation syndromes who have not previously received any target KIT inhibitor therapy and in whom symptoms are not well controlled by best supportive care. How can we measure the activity of this drug? We can use some parameters, in particular bone marrow mast cell burden decrease, serum tryptase level decrease, and the peripheral blood KIT D816V variant allele fraction trend. This is the trial design. So at the beginning, we start from a part 1 in which 40 patients will be randomized to receive placebo or BLU at 3 different dosages in order to determine the recommended dose. Once this dose will be achieved, all these patients will roll over to part 3. Then we have a part 2 with more than 300 patients to be enrolled and again randomized to receive placebo or BLU, always in combination with best supportive care, in order to assess the proportion of patients who achieve more than 30% of reduction of symptoms, which are collected through specific tools such as the ISM, SAF, TSS score. And then a part 3, the long-term extension, and open label extensions for up to 5 years. There are always 2 additional parts, the part M for monoclonal mast cell activation syndrome patients and 2 PK groups for patients which will be enrolled only to assess pharmacokinetics data. These are the most important inclusion and exclusion criteria, so I just wanted to underline that all the diagnosis of indolent systemic mastocytosis will be centralized in terms of both bone marrow evaluation and BNC findings evaluation, and all the patients need to have failed to achieve adequate symptoms control with standard of care. Among exclusion criteria, all patients with another myeloproliferative disorders or patients who have other type of systemic mastocytosis can't be enrolled. And again, patients who are receiving other KIT inhibitors concurrently not be enrolled in this trial. Regarding endpoints, as I already said before, recommended dose is achieving the recommended dose is the main primary endpoint, together to assess the safety, tolerability of the drug, and the reduction of symptoms over time. Among secondary endpoints, we need to assess the trend of serum tryptase level and KIT D816V variant allele fraction. Approximately 70 sites are involved in 15 countries worldwide, including Italy, including Bologna, so we would be happy to receive patients coming from your institutions and to offer this kind of opportunity to them. And these are the conclusions. It's a phase 2-3 study designed to assess safety, efficacy, tolerability of this compound in this patients' population. For more information, this is the website, and I thank you all for your attention, and I will be happy to take questions.